Hello friends, hope you're all okay. You're enjoying your life, you're enjoying watching my videos, and also you're enjoying practicing ultrasound. I'm Dr. Arshad Nadeem Awan, working as sonographer in England. My topic of discussion is malignant liver masses. Malignant liver masses has a broad spectrum. It includes hepatocellular carcinoma, fibrolamilar carcinoma, hemangiosarcoma, epithelioid hemangioendothelioma, and metastatic liver disease. Highly sensitive topic, highly important topic, and early diagnosis can save the patient life. You cannot deny the importance of this topic because early detection of the cancer can save the patient life. How this cancer, how this malignant masses appear on the ultrasound images, how we will differentiate it from one another, and how we will write the report. So this video will include all these information. So let's start watching this video and start appreciating and differentiating all these malignant liver masses. So let's get into malignant liver masses. Hepatocellular carcinoma or HCC is the most common malignant tumor. HCC occurs predominantly in men. Hepatitis B and C infection accounts for the high incidence of hepatocellular carcinoma. Alpha fetoprotein is usually elevated in hepatocellular carcinoma. It appears in three forms. It appears as a solitary tumor, or it may appear as a multifocal nodules, or sometime in diffuse infiltrative form. Sonographic appearance are variable. It appears as a hypoechoic, it may appear as an echogenic, or it may appear as a mixed mass. If the tumor is less than 5 centimeter, it usually appears hypoechoic, and there would be no necrosis in the tumor. And sometimes you can appreciate a small hypoechoic halo around the tumor. With the passage of time and increasing in size, it becomes heterogeneous, and you can appreciate intratumoral necrosis and fibrosis as well. Large tumor may contain fats in it, so because of the fat content on the CT scan, it can be easily distinguished. Sonographically, this tumor is highly vascular when you put the Doppler signals on it. Doppler ultrasound help us to find new vascularity and also help us to find the portal vein thrombosis. It has multiple appearances on the ultrasound imaging. How it will appear on the ultrasound imaging, how we will differentiate the different pattern of the HCC. Let's start watching these images, and you will be able to identify all the different patterns of the hepatocellular carcinoma. This slide shows the cirrhotic liver. You can appreciate coarse parenchyma of the liver. You can also appreciate that margins of the liver are also irregular. You can notice that liver parenchyma is interrupted by multiple well-defined small focal hypoechoic nodules. These are variable in sizes and also in shape. These are called as hepatomas, or you can also call it hepatocellular carcinoma, or in short you can call it HCC. This presentation of HCC is very common in well-developed cirrhotic liver. Again, this another slide shows a cirrhotic liver. Coarseness of liver is appreciable. You can appreciate that liver is coarse, although you can't appreciate margins of the liver clearly in this slide. Hepatoma in this slide present as multifocal nodules which are really very difficult to differentiate from the surrounding liver parenchyma, and if clinician is not expert and has not seen such cases before, it's likely that he may miss this presentation. But still, this weird look will attract his attention that something is wrong with this liver. This type of a presentation develops even with the starting of cirrhosis and required contrast enhanced CT scan to identify its malignant potential. This slide shows a cirrhotic liver as well. Although margins are smooth and regular, there is no irregularity of the margins. It means that it's not well developed case. You can consider it as an early stage. A well-defined echogenic nodular focal mass can be seen in the right lobe. This is an echogenic nodule. Usually HCC presents in this form as well. But the problem with this type of appearance is it confused with hemangioma and quite often labeled as hemangioma and miss the diagnosis. Therefore, in such cases, it's important to give your differentials as a hepatoma and hemangioma and advise further radiological imaging, that is contrast enhanced CT or contrast triphasic CT scan, so that you can differentiate between the hepatoma and the hemangioma. On this slide, you can appreciate cirrhotic liver. Parenchyma is coarse and granular. You can appreciate this coarse parenchyma and granular pattern of the liver parenchyma. Margins are irregular and liver is surrounded by ascitic fluid. It shows that it is a well developed case. You can see a well defined, large, comparatively echogenic solid mass almost occupying the entire right lobe. Mass can be distinguished from the liver parenchyma and an interface between tumor margins and liver parenchyma is visible. It looks as a solitary mass large enough to occupy entire right lobe. This type is solitary mass type hepatocellular carcinoma. It's another example of hepatocellular carcinoma. Have a look and you will see a well-defined large mass with mixed echogenicity. Mixed hypoechoic and hyperechoic areas are seen within the tumor. Margins of the tumors are slightly irregular. Tumor is large enough to occupy the right lobe of the liver. In the background, liver parenchyma is mildly coarse. However, you can see that the margins of the liver are smooth. This is the best example of solitary mass type hepatocellular carcinoma. Here is another example of hepatocellular carcinoma, a well-defined large size mass almost occupying entire liver, both right and left lobes. This is a lobulated mass with heterogeneous parenchyma, and you can appreciate a central hypoechoic area which is called as central scar. This type of presentation you can also see in fibrolamilar carcinoma, but the difference between hepatoma and fibrolamilar carcinoma would be that in fibrolamilar carcinoma there would be central scar and punctate calcification. Beside this, the liver would be normal. There would be no liver pathology, there will be no cirrhosis. But in hepatoma, liver would be cirrhotic and you would see a large mass, and there may be a central scar. As you can see in this slide, there is a central scar, but liver is cirrhotic and margins are irregular and there is no punctate calcification, so it means that it is hepatocellular carcinoma. Here in this slide, you can see that the thrombus within the portal vein is visible. Portal vein is dilated and echogenic thrombus is visible within the portal vein. It could be either direct invasion of tumor within the portal vein or maybe thrombus secondary to hepatocellular carcinoma. This slide is actually an extension of the expansile tumor within the portal vein. Thrombus tumor is visible, portal vein is dilated and almost blocking the entire portal vein. There would be no blood flow if you put Doppler signal on it. Another presentation of hepatocellular carcinoma. Look at this slide. Liver is shrunken, small in size, margins are irregular, parenchyma is nodular, coarse and cirrhotic. Marked ascites is visible. On the left hand side, on the superior aspect, you can see a small tumor protruding out of the liver parenchyma, out of the liver margin. This is actually hepatocellular carcinoma and it may present in this form as well. This type of a tumor is called as exophatic tumor. Superficially lying comparatively echogenic tumor can be seen in this slide. You can see that liver is coarse, although margins are smooth and regular, but you can appreciate surrounding ascites. Tumor margins are smooth and round and it occupies the right lobe. This is superficial mass with mixed echogenicity. As I mentioned earlier that hepatocellular carcinoma presents in three forms. It may be either solitary tumor or multifocal nodules or diffuse infiltrative form. This example is of solitary tumor. This slide shows portal vein thrombus. Here you can see that portal vein is dilated and filled with the hypoequic thrombus. If thrombus is acute and newly developed, newly formed, it would appear hypoequic on the ultrasound imaging, and if it is chronic, then the echogenicity would be increased and it would appear echogenic. This is a malignant thrombus and can be seen in this slide clearly. You can see that on Doppler imaging there is no blood flow in the portal vein, but surrounding vessels shows vascularity. This is because of development of collaterals. When portal vein get blocked, surrounding new vascularity develops and it is called as collaterals. You can appreciate this on putting Doppler signals on it and it will show blood flow. Malignant thrombus is usually a significant complication of hepatocellular carcinoma. So this is the example of malignant thrombus of the portal vein secondary to hepatocellular carcinoma. Yes guys, this was all about the hepatocellular carcinoma, and you have seen different appearances and different patterns of hepatocellular carcinoma on the ultrasound imaging. HCC is also called as an hepatoma. You can call it hepatoma as well. While writing the report, the first important thing is you have to take the size. Take the size in 3 dimensions, give its location where it is located, and second, you have to just discuss about how it appears, if it is hypoequic, or it is multifocal, or it is lobular, or it is exophatic mass, whatever the ultrasound characteristic or echogenicities, you have to mention that as well. The second thing is always focus on the surrounding liver parenchyma, because the liver would be cirrhotic, the degree of the cirrhosis, how much coarse liver you can appreciate, and also comment on the surrounding margins, whether margins are smooth or margins are regular or irregular. Whenever there is hepatoma or hepatocellular carcinoma, must observe for the intravascular or intraparenchymal vascular structure. This would be distorted, or this would be slightly pushed outside because of the tumor effects. You have to look for the portal vein thrombus as well. Take the portal vein size, put the Doppler on it. If there is vascularity, it means there is no thrombus, and if there is no vascularity, you can suggest there is no flow, likely be because of the thrombus, or if even sometime you can see echogenic thrombus within it. So the report writing pattern I have already discussed in previous presentations, in previous videos. You can just take the example of all that and you can put it for this hepatocellular carcinoma. So I'm not gonna separately write the report because I have already written these reports for you. So this was all the pattern, and you have to mention the size, mention the location, mention the portal vein, the status of the liver, the coarseness of the liver, the margin. All these you have to mention on the report, and this would be your classic report for the hepatocellular carcinoma. Beside this, it's worth mentioning here that when you detect anything on the ultrasound, because of the differential, we are trying to reduce our differential as much as possible. If you have the accurate knowledge and you have seen all these categories before, I am sure you will not miss the hepatocellular carcinoma. But another important thing is always mention the further radiological imaging, right? Triphasic CT scan is the important method, important diagnostic radiological diagnostic tool to detect the different types of the masses. So on the report, mention that further radiological imaging is advised, or CT triphasic is suggested for further workup. What comes next to hepatocellular carcinoma is fibrolamilar carcinoma. Fibrolamilar carcinoma is actually subtype of hepatocellular carcinoma, and you can appreciate this cancer in young patient, in adult patient, and second, there will be no coexisting disease. It means like fibrolamilar carcinoma can be seen in normal liver. The size of the tumor ranges from 6 to 22 centimeter. So how we will differentiate it from hepatoma? Fibrolamilar carcinoma happens to be having punctate calcification within its parenchyma, and second, there will be central scar. So these two are the distinguishing features on the ultrasound from the hepatoma. How it will appear on the ultrasound images? Let's watch these images. This is the image of a young female, and in this slide you can see fibrolamular carcinoma. This is the example of fibrolamular carcinoma. That was a young woman in her 40s, and you can see a large heterogeneous solid mass occupying the right lobe. Although you can't see surrounding parenchyma of the liver clearly, but liver was normal in that case, and there was no cirrhosis. Criteria for the fibrolamular carcinoma is that liver would be normal, there will be no cirrhosis, there will be no previous liver pathology. So you will see the normal liver on the ultrasound. Mass would be large, ranging from 6 to 22 centimeter in size, and within the mass you would see central scarring and punctate calcifications. Here on this image you can appreciate a large mass. There is normal sized liver. The echogenicity of the liver is normal. No previous liver pathological process is seen in this liver. A large predominant hypoechoic solid mass of the liver is visible. You can appreciate in this image that there is punctate and linear calcification within the tumor. However, central scar is not clearly visible on this image. As I mentioned, that fibrolamular carcinoma must be having a punctate calcification and central scar within the tumor, which is the distinguishing point from the hepatoma. Tumor margins are smooth in this image. Surrounding liver parenchyma is normal. So this is fibrolamular carcinoma with punctate calcification, and this is a classical example of fibrolamular carcinoma. Yes friend, this was all about the malignant liver masses. I have discussed about the hepatocellular carcinoma at length, how it will appear on the ultrasound imaging, how we will appreciate its different pattern on the ultrasound images. Fibrolamular carcinoma, we have also discussed at length. We have also discussed the distinguishing feature between the hepatoma and the fibrolamular carcinoma. So far, the hemangiosarcoma and epithelioid hemangioendothelioma is concerned. These both tumors are very rare, and it's indistinguishable on the ultrasound imaging from the hepatoma and fibrolamular carcinoma. So therefore, always advise triphasic CT scan for the workup. Keeping in view the importance of the metastatic liver disease, I have launched separate video for the metastatic liver disease. I'm particularly thankful for the feedback. Some of the guys from the India and some of the guys from the Egypt, they are keep sending me their valuable remarks. I'm really thankful for that. Keep watching my videos, keep sharing my channel with other colleagues, and keep sending me your feedback. So we will see in the next videos with hepatic metastatic disease. Till then, take great care of yourself. Keep watching my video. See you in the next video. Bye bye.